Hello everyone, my name is EHAB AbDul. I am from Yemen. My supervisor is Liu Laoshe. I am in Sichuan University School of Stomatology, West of China. At first, I want to thank NANJING Medical University to give me this chance to attend this conference and to share my research result with the title of three-dimensional assessment of favorability of posterior maxillary teeth intrusion in different facial type, limited by the vertical relationship with the floor of the maxillary sinus. In a way of introduction, as we know, most of us in the dentistry department related with the maxillary sinus, like the maxillofacial surgery department, also implantology department, also in the odontology department and orthodontology. As my major in orthodontics, I related this relationship between the maxillary sinus floor and posterior maxillary teeth related to the different vertical facial pattern, which is hyperdivergent and hypodivergent and normodivergent. So when we have a patient with anterior open bite, as we can see for these photographs, if we need to treat this patient, we must do intrusion for posterior teeth. When we do this intrusion to treat this patient, maybe there was a little bit of resorption, so that this resorption may be occurred due to the level of applied force and the surrounding bone anatomy and the exact distance between the root apex and the cortical bone lining. What is the goal of this study? The significance of this study, information about root sinus distances in skeletal growth pattern is still limited. Also, and clinically, this study will participate in increase the acknowledgement of the orthodontics in the planning of orthodontic intrusion of posterior teeth. Also, help of posterior teeth intrusion, providing correcting and adequate treatment. So, the goal of this study is to investigate the correlation between the maxillary sinus floor and maxillary posterior teeth in different facial pattern in adult Chinese population regarding to age and gender and type overview, sagittal and coronal. In my study, this retrospective study including 298 patients divided into hyperdivergent, which is 94 patients, and hypodivergent 102, and normodivergent. I use to measure the distance in the apical and the coronal and sagittal view, as we can see in this slide. To determine the vertical correlation between the patients, I use two measurements. One measure is a linear measurement, which is MBS angle. The other one is a linear measurement, which is a Garabach ratio. So we have two types to determine the correlation between the maxillary teeth and the maxillary sinus. Type 1, when the root is away from the maxillary sinus, as we can see in the first photograph. The second photograph, which is type 2. Also, type 2 has three subdivisions. So, first subdivision is the type 2 contact, when the root is come in contact directly with the sinus, and type 2 lateral contact, when the root come in lateral contact with the sinus. And finally, type 2 penetrate, as we can see when the root penetrate to the sinus. So, in the type 1, the value is calculated as a positive value. For the type 2 penetration, it's considered as a negative value. For the contact type is for a zero value. For a result, as you can see from this table, in both view, sagittal and coronal view, there was statistical significance in the age in all hyperdivergent and hypo and normal regarding to the age, and we can see whenever the patient has a large age, whenever the distance is increased. Also, with regarding to the gender, we can see in the hyperdivergent, the male has a shortest distance from than that of females, because the male has a large maxillary sinus than that of females. Also, with regarding to the scores, there was statistical significance in both views, sagittal and coronal. And when we can see the differences between the correlations between the apex and sinus distance, we can see the most root away from the maxillary sinus, which was the first premolar, upper first premolar, and the most root near to the maxillary sinus, as we can see the mesobuccal root of the upper second molar. And the frequency of the root position, as we can see, the most prevalence type score is the type 1, that is away from the maxillary sinus. and followed by the type 2 ventilated. In a way of conclusion, maxillary molar of hyperdivergent group with the majority of type 2 ventilate root sinus relation show the highest possible risk of root resorption during molar intrusion, while the hypodivergent group has the latest. Also, the highest ventilation incidence of the difference facial growth pattern was the maxillary molar second molar mesobuccal root. So, when we do any intrusion for the maxillary posterior teeth, we must use a light force in order to reduce this resorption. This paper is published in the Clinical Oral Investigation. Also, I have the same project, but in anterior posterior relation with the skeletal classes. Is published in the Head and Face Medicine. Finally, I want to send my great thanks to my doctoral supervisor, Leo Lavche, also for my master degree, Professor Xiaobao Chang. Thank you all for listening.
Thank you very much. 我们还有一点时间可以问个问题。
We have question.
Thank you, Dr. EHAB, for your nice presentation. I have a question, please. In your method, why you didn't study the relationship between the maxillary sinus and the root apex in the transfer relationship? Thank you.
I get your question, my dear friend. I studied this study in my next project, but it is still in progress. So that I will study it, maybe in the next time.
Okay.
Okay, you are welcome.
没有别的问题了，我就宣布个好消息啊！我们下面是茶歇啊。大家在